Hey guys, Dr. Ellie here. I'm just popping in to say I'm so excited because Dr. Julia has so much to say that was so valuable that we actually had to break it into 2 parts, so don't miss out. So I'm loving all of this. For those of y'all that don't know about sleep apnea, if you as a parent have like sleep apnea, which just means that you like stop breathing at night, like that's not like a little thing. So I'm just going to put that out there medical wise. Y'all parents that are ignoring your sleep apnea, y'all need to get in because that can cause major issues with your heart. And a lot of people don't know that. And almost every single one of us, especially in the USA, is like at risk for heart disease. So like, please like get that addressed. And I love that we're addressing it early in kids. And I love that you made the connection between sleep and ADHD because as a holistic pediatrician, this is one of the biggest things that I see overlooked. And same with growth. So for example, oftentimes when kids will come to me with ADHD, sometimes parents have like been out and about getting help elsewhere and it just hasn't been like effective. And that's why they're seeking me out. And sometimes it's kiddos that are on like, multiple stimulant medications, maybe more than one, and they're not growing well and they're still not really paying attention and they seem agitated and they're little and all these things. And I'm like, so how do they sleep? And they're like, not good and worse on the stimulant. And I'm like, well, first of all, let's see what's going on with sleep. Because really, if you cannot sleep, you cannot pay attention. I mean, we know that intuitively. Like if I haven't slept well, and I'm a person that needs like a good 9 hours. So if I've slept like 6 hours, I'm going to be looking at you like, can you just repeat yourself?
Yeah,
And yeah, and the
it
same with
it's really
kids.
affects all of us when we don't sleep well, but especially in the formative years of memory consolidation and learning that's taking place at school. It's really hard for these kids, even when they're learning sort of like different motor skills and things like that. This is still all can be affected by poor sleep. So it's so important for sure.
It's so important. And you just don't want your kid to end up on like unnecessary medications if the issue is their airway or their adenoids or anything like that, or just even sleep hygiene, like just like not getting into a good routine.
Yeah. And I think one important thing to kind of tack on to that is like if there are issues or concerns of that, the first thing that most parents can and should do is try to take a recording of your child while they're asleep at night. You can watch the recording back and see if they're snoring, see if they're tossing and turning a lot at night. Just restless sleep patterns can be a sign that something may not be, as peaceful or restorative during their sleep. And bedwetting is another big one that causes interruptions to sleep at night, whether that's driven by some of the hormone changes of our body kind of waking itself up at night because we're not getting the air that we breathe, or again, some of the sort of pressure changes that can be taking place in the abdomen. So there are definitely things to kind of look at when it comes to sleep. And then if there's a major concern, certainly going to see an ear, nose, and throat doctor can always be a first step in terms of kind of making sure nothing major structurally is going on. But oftentimes what happens then is it's kind of a decision of like, is this bad enough? Like we can try some nasal steroid sprays or we can try something like that. And then if it's like, is this bad enough for surgery or not, is kind of like the end stage of that discussion. And that's why I'm trying to raise more awareness that there's actually a lot of different options to look into dental expansion or therapies that can help retrain how the muscles are working. And all of that can actually change our breathing patterns, change the size of the tonsils in some cases. So just making sure that people know there are some different paths forward if they're meeting sort of a dead end and not getting answers.
Okay, that's amazing because I love that there's options before surgery because no one wants to put their kid through a surgery unnecessarily. And sometimes, we may not even be aware of the options. And I love that you're bringing up some different things. And I want to dive into all of those more. But let's start with just like food because I think about you literally every time I eat a caramel, which isn't too often. But when I do, I'm like, Dr. Julia is not going to be happy with me. This like sticky goo on my teeth. I have to go like brush right away. But like, what foods like support proper jaw growth? Like, what about breathing? Like, what about all the soft foods that we eat nowadays? How does that affect things?
Yeah, so I'll cut you some slack. Everyone's got to live a little bit. But yeah, it's something to pay attention to is again, I mentioned before the sticky textures as something we want to be worried about, but you're right. So much of our diet and part of what's driving these changes to happen that our growth is off track is because we're not chewing like we used to. Our ancestors had to go out and chew for hours in a day to be able to mash up some of the foods that they would find in the wild. And now we have everything in pouches and smoothies and oatmeal, and everything's really soft and processed in a lot of cases. Even if it's not processed,
Hmm.
there's still a lot of foods that are tending to be soft. So making sure, I mean, I love the baby led weaning movement as an option for as kids are getting old enough to introduce solid foods and making sure that they're starting to use chewing muscles. Because again, the way that we introduce foods and use our muscles is a driver for our growth and development. So being able to do some, as things progress, age appropriate, obviously, and being able to introduce crunchier foods, crunchier fruits and vegetables, making sure that it's, not just applesauce, but actually like taking some time to chew on an apple and making sure we're getting that chewing pattern, chewing on both sides, and being mindful really of also, parents are often the ones modeling how we eat for our kids and being mindful, sometimes just turning around and making sure that we're all taking some time to eat something that's a little chewier. Obviously tending towards, from our perspectives, less processed foods when possible. But sometimes, I mean, like a crunchy baguette might be the solution if someone's not wheat sensitive. Jerky for some kids can be an option. I still always caution a little bit with dried fruit because that is just concentrated sugar.
Sugar.
So it can be a treat, but not something you rely on regularly. But just making sure that there's some variety and it's not just mac and cheese and chicken nuggets and softer foods for sure.
Yeah, and it's such a struggle. And I think also like there's a lot of fear around progressing textures because understandably people do not want their babies to choke. And that makes a lot of sense. And I think it's important that you're emphasizing like it is important to progress these textures. Like we don't want to stay like, maybe you haven't done baby led weaning, but you could, but let's say you haven't. And now you're like, we're on the pureed, whatever, sweet potato for 5 months because that would be like what, like 11 months old. That might not be the healthiest for the mouth because now we don't know how to, like maybe our tongue has become weak and we don't know how to swallow. And that can lead to all of these issues down the line. So
And
while
vice
being mindful, yeah,
I was just going to say vice versa. Times, realistically, some of the kids are pickier eaters because it's harder for them to chew. If there is an issue like a tongue tie or something like that that's been not on anyone's radar, it can be harder to properly chew and move the food around. So, and if we're even just from mouth breathing alone, if that's a child's default mechanism for breathing, they're not going to want to spend the time with something else in their mouth, chewing that food. They're going to want to swallow something soft and easy as quickly as possible because then they can go back to breathing through their mouth instead. So it does go both ways. And again, we have to do everything we can to support these kids. I'm not saying don't feed your kids, like do what you need to do to get them the nutrients they need. But if you need support, that's the biggest thing. There's therapists who can help with feeding and making sure that there's support, that they're getting the support they need to learn to use those muscles differently.
yeah, 100%. And I feel like Dr. Julia, like maybe if you have time or you're available, I feel like we should do a whole episode just on tongue tie because that's like a thing. I
Yeah.
mean, we could talk about that forever. So if you guys want that, if you want to hear about tongue ties, let me know and I'll see if Dr. Julie is available and then we'll put it together. I wanted to talk just a little bit too about like pacifiers. That's a big question I get. Like bottles, like do I need to like change the flow on the nipple? Like is the bottle terrible? Like what if I don't have breast milk? Like is this going to negatively affect airway development or even like thumb sucking? Like, how does that affect things? What do you recommend for all of those things?
Yeah. So I will say, the pacifier has a time and place that it's recommended for the little ones. It's approved and encouraged for younger babies who we need to make sure that, they're breathing well at night, and that has been linked to supporting their breathing early on. So certainly encourage pacifier use in the very newborn population, and certain designs are better than others. So I know some of the ones that come up more regularly are like the Avant Soothie or the Ninny, because the shape of them is a little bit different. It's more cylindrical, and it actually is more, you can like put your finger through and do some suck training for them to sort of stimulate suck training. And they're going to be more likely to engage certain muscles with that design of a pacifier. So certainly it is recommended early on to use pacifier. I'm not going to tell anyone what they should or shouldn't do in the early stage. However, weaning off the pacifier should begin around 6 months of age, which most people don't realize. So it's something where, there's different strategies that have to be employed. I know a lot of my friends' kids right now, they're 2 years old and trying to get the passy out. And it's become a much larger emotional crutch at this point in time. So if we can get away from using it early, that's for the best. Anywhere between 6 months to 12 months is a good window to try and start kind of practice first soothe and remove, and kind of come up with a different protocol there. With that being said, I certainly think a pacifier is a better tool than a thumb, because a pacifier is a lot easier to remove than a child's thumb. So
We
again,
don't want to do any of that. No surgical
no.
procedures.
And the thumb puts a lot more pressure on the developing jaw in that way. So in a negative way, putting more pressure there on the roof of the mouth. And kind of the concern becomes affecting, again, the way that the jaws are going to grow forward and widen. It can really put that pressure that causes the jaws to stay very narrow, the roof of the mouth to be kind of vaulted. There's of course there's a lot of like feel good hormones that are released from the sucking, and that's why the kids do tend to gravitate towards those activities early on. But certainly, yeah, I would encourage a passy over the thumb. And then kind of when it comes to bottles and breastfeeding, like, of course, I think there's a lot of advantages for our growth, for our nutrition, to be able to feed by breastfeeding, but it's not available to everyone. And just because you have to rely on bottle feeding doesn't mean you're going to be kind of in these troubled areas. There are other things. So looking at, factoring in diet early on that is more varied in texture. So kind of counterbalancing the fact that you had to rely on the bottle. We just use our muscles differently when we're feeding from a bottle versus breastfeeding. And so doing other things, finding toys, there's a lot of different toys that can be relied on to practice kind of chewing early on. Some things like the Myo Munchie brand has even like a little baby munchie. And there's other ones that the Myo Munchie's a little tool. It's like a little silicone. It's kind of like a chewy toy for little kids that helps get
I
some of
love that.
the
Yes, a little chewy. Okay,
there's
good.
definitely like tools and tricks. And again, there's a lot of things parents can do at home by themselves to get started with things. But if someone's feeling stuck and they've got this reliance on, now the thumb is a part of life and we can't get rid of it, or even the passy being a part of life and we can't get rid of it, there are actual support through, I know you've had an occupational therapist that you work closely with on here. Like, it can come from a variety of different professionals that can actually make themselves available to support you through that process if you're finding that you need support. So I think the earlier the better, but definitely by age 3, 4, if we're like not out of the woods yet, it's time to get some professional help. That's my opinion.
Yeah, I love that. And definitely, Dr. Julia will link Stephen Kempler from Whole Family Therapy, because he's amazing. He does infant training as well with these like little toys and stuff like that. And for those of you who don't know, and I probably haven't mentioned it before, I'm making a whole course on how to feed your baby from 0 to 12 months so you don't end up with some of these issues. And we talk about baby-led weaning, and we talk about the breastfeeding. We talk about all the things and
Such
the
a good
purees and
foundation.
yeah, all this stuff. But going back to like other interventions, because I've seen some like cool things. Like today I was looking at the straw that you had recommended on your freebie, and I'll link the freebie that you have too. We can talk about that at the end, but you have like some super good information that all parents should really just go ahead and like get and download, because it's free and it's awesome.
Thank you.
Yeah, but there's like a lot of different interventions, like including that straw. Like, what kind of things do you recommend? I know you mentioned the toys already, but like, what else can people do at home? And then when should people get like professional help versus just kind of working stuff at home?
Yeah. So yeah, you mentioned like earlier things. And then the keyword straw just triggered for me. But really, if we can encourage like straw drinking or open cup drinking early on instead of sippy cups, that's going to be an ideal sort of stepping stone in using our muscles the way that they should be used. It's something that, again, was kind of designed and invented for the convenience of parents. So again, if you need to use it on the go on occasion, do what you need to do, but that shouldn't be your default. If you're at home and you can use an open cup or you can use a straw, definitely better to transition straight to that.
Yeah, I always tell people like go outside. Like it's fine. Like you don't want to clean up that mess if it's a warm enough day and it's not like pouring rain or snowing or something. Like just take the food out and go drink and then come back in. Because I
For
do
sure.
get it. It's like a hot mess. I mean, let's be honest, we all need like a tarp and like a fire hose, but it is good for oromotor control.
Yeah. And again, I guess for me, the time in which to seek some therapy out is, if you're having a lot of trouble with drooling or dribbling and things just aren't kind of seeming normal, like if that's more excessive than other kids, if again, meal times are a complete battle, there's definitely different times in which seeking out support, whether it be from an OT, a PT, something called myofunctional therapist. And again, if you go to the freebie that Dr. Ellie will share with you, I've got a lot of information in there that I consider kind of foundational knowledge. So it's a good place to start and get kind of the basics with what you can do around the house to make a difference.
Okay. And Dr. Julia, what's the name of your freebie?
So I call it the Healthy Mouth Manual.
That's right. The Healthy Mouth Manual. You guys, I literally read this like I've read it like 3 or 4 times and sent it like I think 3 or 4 patients, honestly,
So
because it's really that good.
thank you.
Yeah. Okay. We will link that. And then okay, before I know you have to go in a minute here. And you've been so kind to spend this time with us. But I just want to ask you, like, before you run, what are some common myths and misconceptions about like pediatric kid airway health you wish more parents just like knew? And
For me,
pediatricians.
yeah, for me, the biggest thing, I guess, kind of going back to what I was saying with like the ENT being kind of the direct path forward for a lot of families. For some families, that kind of results in a roadblock. Parents aren't necessarily ready to consider surgery, but they don't know there are other non surgical options. And so for me, the biggest thing is just understanding that and really the controversy, it unfortunately exists among the field of dentistry as well. A lot of dentists don't know this exists, so it can be a hard thing to navigate. But knowing that there are different methods to influence growth. So some things, certain dental appliances might be needed, therapies can be helpful. It doesn't have to be one way forward or another. There are some sort of like campy groups that say like you have to do this first or you have to do that first. And I think my whole biggest thing of kind of my reason to exist is to meet the parents who are running into some friction and something doesn't feel right. And just knowing that there's always something you can do. And that's kind of my word of encouragement is keep digging, keep finding more answers. And if Dr. Ellie or I can be the resource to point you in the right direction for next steps, that would probably be the biggest message.
Yeah, that's amazing. I love that because I also find myself working at the intersection and not in individual camps. And I also think in general, health is like a very nuanced thing. And when you start into like blanket statements, it's a very nebulous, for lack of a better word, it's a very murky place to live when you start just saying everyone should XYZ. And I'm like, there's probably more to it depending on the situation. I mean, unless I guess you're like literally like bleeding out from a car accident, then you probably do need like some kind of intervention. Well, although if you're like a Jehovah Witness, maybe not. So there you go, nuance, you
Yeah.
guys. Nuance. I am telling you what, as soon as you get black and white. Dr. Juliet, can you explain to people? So I know that a lot of people come to you for support because they are just not even sure where to turn. They don't have a holistic dentist in their neighborhood. They are confused. Like, where can they find you? How can they work with you? When should they find you? All the things and all of that.
Yeah, I think if anything that I've said today resonates and makes you curious, first thing is to go to my website. We'll link to that, but it's oriswellness.com. And there's a lot of free resources on my website that I encourage parents to check out as a starting point. I certainly think that, there's a lot of information and depending on how prepared someone is to do the research and figure out these options. There's a lot of different ways it can go. I think the reason why a lot of parents reach out to me is they're feeling overwhelmed, they're feeling kind of paralyzed with what feels like the right next steps. And that's where I do offer like one-on-one consulting to meet with the parents and understand the situation for their individual child, and making sure that I'm not diagnosing anything. I'm simply going to educate you on what the options are and what may feel aligned for you. And in certain cases, I can do research and figure out who is the provider in your area offering that type of service.
Yeah, so you guys help us here. Even if you live somewhere where there's only like 2 other people in your town, like you can still get help for all these issues, and you can definitely get Dr. Julia's freebies. And thank you for coming. You're amazing. And I have like secret hopes that one day we're going to like do some like amazing course or membership together. So crossing fingers.
I would love that.
That would be super cool. All right, you guys. Well, I'm Dr. Ellie. I am wishing you well. And if you want my free guide, it's the free natural medicines guide. It's on my website, middlepathintegratedpediatrics.com. And I also have like a whole hour-long video literally on how to like stay healthy during pregnancy so you can have a healthy baby. So check that out too. And if you don't know me, I'm Dr. Ellie. I'm with Middle Path Integrated Pediatrics in Asheville, North Carolina. I take care of kids 0 to 21 and do holistic peds, and then also people for functional medicine ages 2 to 102. Okay, wishing you well. Bye.